Hello, and welcome back to the second learning objective where we are going to focus on corporatization of healthcare in the US. So, corporatization, I'm sorry, it refers to the adoption of private sector business models, which kind of focuses on profit-oriented goals and corporate management principles in how you deliver and manage healthcare. So it's more or less like prioritizing a shift on how healthcare is delivered from looking at it from a public community service to something that is more market driven, and it's more concerned about efficiency, standardization, and the big one being profitability. So that is what we mean when we're talking about corporatization of healthcare. So it does have relevance in modern healthcare, one of which is that corporatization has transformed healthcare delivery. It has influenced how hospitals are managed, insurance design, in terms of retail services, which we're going to talk about, and, in terms of outpatient care models. So, but it does have impact in the sense of there has been increased efficiency. There's been a lot of consolidation of providers, which I mentioned in the first learning objective, but it has also led into the expansion of consumer facing services, which we're going to talk about. But an example would be retail clinics and telemedicine platforms. I'm going to give an example of operational efficiency in terms of how it's increased that, and I'm going to use an example of when I was in the UK versus living in the US right now. So the UK, which I have mentioned, operates on a national healthcare system, and I remember the first time that I needed to use the ER, and I walked into it. I wasn't in a great shape, but I had to, ER was the only other option that I had to get healthcare very quickly. And I walked into the ER, and I think I may have waited for about 2 hours. And while I was waiting, nobody asked me any question. Nobody asked me any question at all. But after the 2 hours, I was feeling, in a better state. So I just walked off and went home, and nobody noticed that I was there. Something like this would never have happened in the US, in terms because there's a bit of seeing you as a customer and a paying customer. So once you walk into it, they see their money, and they don't want their money to walk out, that sort of thing. So there's a bit of focus on operational efficiency and trying to make sure that if you need service, you're going to get it. If you can pay for it, I have to put that caveat in there. So and that's very different. That is one of the ways that corporatization of healthcare has increased operational efficiency, because there's a sense of customer service in terms of how they're relating with patients and trying to, as much as possible, give them to make them happy with the services that they are paying for. I need to emphasize they are paying for. For those who can pay, the focus is trying to give you the best service that your money can buy. However, the corporatization of healthcare has also brings up very critical questions. A lot of it is focused on healthcare equity, and in terms of access, affordability, and quality. It has worsened this three things. So, the characteristics of corporatization in healthcare is that, firstly, it is very much market driven, profit driven motives. Corporations prioritize how high revenue services like cardiology, elective procedures that are going to give them the most money, and also deprioritizing low margin services like behavioral health, or providing services to those who are in the rural communities. You find that there are a lot of health professionals that are training to become this specialist care, because that's where the money is, far more than you have healthcare professionals that are training to become primary care providers. A lot of that is driven by the corporatization of healthcare in the US. So it does create gaps in access, particularly for essential services and for vulnerable populations who cannot pay for these high revenue services and have to kind of depend more on preventive care for when they can get it, and not being able to get it, they kind of forego this high revenue services. So an example of market or profit-driven motive would be where you have the corporate system that is expanding surgical suits, but it's reducing money that goes into inpatient psychiatric services. And this happens not just in terms of within corporates. There are countries that have spent a lot of money on providing cosmetic services that they are, having people come from different countries just to get their service. There's very, very much profit driven, far more than it is about improving health outcomes. So that's an example of a corporatization of healthcare. However, another thing about the corporatization of healthcare is that there's standardization and centralization. You have corporate systems being able to implement standard protocols, administrative processes, or within that system. So when you, for example, you have an organization absorbing, let's say you have a big organization that absorbs 20 hospitals around this area. Instead of there being 20 systems of how to get things done, it will just be one, because now all of these 20 clinics have become one system. And so the way things are being done by these 20 clinics will be the same, because there's been a standardization and a centralization about it. So that is one of the things that happened with corporatization of healthcare. But it does, improve performance metrics and also facilitates efficiency and consistency. So the centralized management that comes with corporatization of healthcare is that you have the management somewhere that is overseeing staffing, resource allocation, and focusing on economy of scale. What happens is that decentralized management focuses on how do we get the most money, and not so much interested in how do we get community specific needs done. For example, in Hammond is a pretty small town, but you have, I think, up to three Walgreens that has been in Hammond, and they're within 10 minutes drive from each other. And however, you would have, like for example, rural areas that may not have a single Walgreens in it, or if it does, it has one, and it's serving large geographical location and large population who probably have to drive 15 to 30 minutes just to get to the Walgreens. So that is some of the challenges with centralized management, where it is focused on economy of scale rather than community specific needs. Like, you would think community specific needs get to Walgreens per city, and this way every city or every location gets to have the convenience of getting to Walgreens within 10 minutes, for example. But that's not how that works in that sense. So another example is that corporate chains may standardize staffing ratio, again across locations, but they would only focus on in terms of where do we get the most money. Like, they could decide every location gets 5 staff in it, even though some locations kind of need like 10, but you have those 5, 7, the large patient demography. And because they have standardized, this is how we want a staffing ratio to happen across locations. So that it doesn't really take into account what does the community need. It's more or less like we want to make it easier that every chain has this number of staff, and we know how much amount of money that is going out in terms of paying for staff, for example. So, corporatization also leads itself to consolidation and economy of scale, which I've talked about. So, we've talked about mergers and acquisition in the first learning objectives, talking about how it leads to dominating regional areas and also reducing competition. All of that comes with corporatization. So, what that happens on one part, you have it improving negotiation power, and it also having more power in terms of being able to influence healthcare policies. But it also has this health providers behaving in ways that is very monopolistic and therefore leading to higher prices. So, but another thing that corporatization has also done with healthcare is it has led to technological advancement. Like I mentioned in the first learning objective, the US is a leader with health innovation and health technology. A lot of that was made possible because of the corporatization of the US healthcare system, because corporations are able to leverage EHR systems, are able to leverage telemedicine and AI diagnostics in order to improve operational efficiency and able to deliver better care and therefore getting patient outcome. And it could do that because it is having to standardize in and centralize their systems. In that way, they are able to figure out where do we take money out of and put money here and all of that, and they're able to put in all of in that sense. So it then has something like a consumer facing tools, patient monitoring, portals, mobile apps, and things like remote monitoring that has helped to enhance patient engagement as well as patient confidence when it comes to healthcare services and receiving healthcare provided provision. So, an example of a tool that is helping with patient engagement and convenience would be the telemedicine platforms like the Teledoc Health that did a great work during the COVID-19 pandemic. So, one of the ways the US did well when it comes to healthcare during the COVID was how within organizations, within healthcare system, it was able to to pivot very quickly when COVID happened. That happened very suddenly, and businesses had to close and things kind of shut down. A lot of that was able to happen because of corporatization. Let's use, for example, if you were trying to get 20 clinics to be able to suddenly shut down and go into only providing essential services and then the rest moving into tele health, it would have been so much more difficult to get that accomplished versus one central system that is able to deploy across those 20 clinics and say, this is how we're not doing things. So that's an example of how corporatization has helped with technology integration. Also knowing that a lot of the times, this technology already existing. They're not having to purchase them or having to get it in because the organization is already focused on patient engagement, on convenience. So they had this technology already existing, and all they had to do was to pivot or expand it and have it do something different from how it was originally done. That can happen because of corporatization. That would not have happened if you had 20 clinics that are all siloed and providing their own internal stuff. They may not have all the technology to be able to pivot so fast. So that is, an example of what happens with corporatization of healthcare. So, what are some of the drivers of corporatization? Economic pressure is one of them. There's rising costs of delivering healthcare for providers, and patients are driven by the need for efficiency and scalability. And so, patients' need for efficiency and scalability is also driving corporatization. And then you have independent providers and rural hospitals not being able to exist in that market, not struggling to be able to work they don't have the financial resources in order to implement advanced technology, for an example, or to negotiate better reimbursement rates or get better coverage in terms of how much they can have pharmaceutical company give them at a lower rate, and stuff like that. So they become vulnerable to being absorbed by the bigger organizations, which just get themselves getting bigger. So those are some of the drivers of it. And so you have many rural areas merging with corporate systems just to be able to gain access to their capital and access to the technology that they have, which often leads to it being at the expense of whatever the community needs, because their focus would then become profitability rather than, patients' needs. Policy changes has also driven corporatization. You have federal policies that are promoting value-based care, which encourages integration and consolidation with the purpose that it would achieve population health outcomes. Not to say that it has in some ways, but also it hasn't in some ways. But those are all policies. So that are pushing for it. Also, the deregulation that happened in the 1980s also facilitated private equity investments in healthcare, and they put in money, they want to get money out, back out. So that's one of the things that's also led to corporatization of delivery. And then you have, this is under ACA, with the accountable care organizations, the ACOs, that have been incentivized to reduce costs and improve outcomes, and getting them to manage certain patient populations. So they're able to say, okay, we will take care of this population, we'll take care of and you take care of this population, and it's all leading to being able to function as a corporation versus being able to function as a hospital that is just focused on my community needs this, and I give them that. So those are some of the policies that have driven corporatization. Private equity has also played a lot of roles, where you have private equity firms increasingly acquiring patient groups, acquiring urgent care centers, acquiring hospital homes, for example. And when they do this, there's kind of a focus on short-term profitability, and there's a lot of aggressive cost-cutting measures that happens within it. You have an example of there being private equity-owned nursing homes having higher mortality rates due to them, reducing staff or reducing staff ratio, and having other cost-cutting or cost-saving practices. But on the consumer side, it's not just only corporate greed that is leading to corporatization. You also have consumers also playing their own role. For example, customers and patients are increasingly demanding accessible, user-friendly care. They want to, the way that you will call Apple Store for if something is going wrong. They want to be able to call hospitals and clinics that quickly and get services done for them. And for those who are, a bit more wealthy than the others, they want to be able to get concierge services in clinics, and want to have like a hotel like service with their healthcare. So these are all customer expectations that are driving corporatization. And then you have the retail health clinic like CVS that had the Minute Care that was offering affordable self-care same-day treatment for minor conditions, and it was really driven by trying to take care of customers' demand for convenience, because we're in a capitalist country, and people are time is money sort of a mindset. So people want to spend the most time in their day, and they don't want to spend 1 hour waiting for healthcare service. So there's a lot of push for convenience, and and healthcare organizations are trying to respond to the market's need for more convenience in that sense. So that's some of the things that are leading to corporatization of the healthcare. So like I may have mentioned, but I want to kind of emphasize it more. There is positive impact of corporatization. It's not all bad, An example would be improved operational efficiency. So there's central decision making, standardized protocol, which does reduce inefficiency within the system. Maybe not in the US healthcare system in general, but within the system, they're able to reduce inefficiency, they're able to streamline healthcare delivery. Also, having that shared service center also does improve billing accuracy because there are fewer different systems working in, so they're able to improve billing accuracy and also lower administration costs. Like I said, this is within the organization, not so much the general US healthcare service system, rather. So you have an example during corporate system was able to rapidly expand healthcare telemedicine during COVID, and we're able to very, very quickly pivot a lot of the non-essential services into virtual care services, which would not have happened, or rather, which happened a lot more quickly and a lot more efficiently because of the corporate system of the US market, healthcare market or healthcare system. So those are some of the positive impacts of corporatization. There's also the access to advanced technology, like I mentioned. So corporations are investing a lot of money into cutting edge tools like AI diagnostics, telemedicine, and robotic surgery system because they kind of have money in that sense to be able to drive those innovations, and patients are benefiting from these innovations. And you have like remote monitoring where you can be in, let's use for example, in a rural area, and you have a doctor that is in maybe New Orleans that is able to monitor what's going on with you, and all of this is advanced technology that corporatization has made it possible. So you have corporate systems being able to that seriously driving towards AI driven diagnostics. Another positive impact is that the broader range of services that they can provide. And also you have retail clinics that are also improving access to emergency care, therefore reducing the pressure on ER services as well. For example, you would have the Med Express urgent care that is able to provide same day care, and you have it's kind of easing off the pressure on the hospital system. There's also improved quality and safety standards. Like I said, they are able to standardize. So you have, for example, like I said, you have uh, 20 clinics operating in a silo, employed in a different ways of employing their staff, and being able to have different hospital discharge systems is not going to operate in the same way as if those 20 clinics were owned by one person, and they're being able to standardize their care, so that in that way has improved quality and also safety standards. And there's a push for accreditation programs and pay for performance models to look at how they are adhering to evidence-based guidelines, and is able to be done because of corporatization, because of the standardized protocol of getting things done. It has also incentivized improvements that has also enhanced patient safety. So the Joint Commission accredited corporate hospitals have consistently met higher safety standards than those who are not accredited. So there are good parts of it. It's not all bad. There's been pretty good. At the other end of it, there's also been very not so great impact of corporatization. An example would be the prioritization of profitable services. There's a lot more focus on high margin services like elective surgeries, and less profitable services like primary and mental health care does not get much funding and much focus on that. And then you have rural clinics, sometimes being forced to kind of eliminate critical services because they have a concern of being able to make enough money to keep their hospitals running. So there's also a rising cost to patients. I talked about how consolidation that happens with insurance and with providers has reduced competition and therefore having a knock-on effect of patients being able having getting getting to the point where they're paying more, also because of the information asymmetry that is also happening there. And then you have health equity concerns, which I've talked a lot about, vulnerable populations being underserved by corporations because they prioritize affluence areas. Corporatization, focuses on profit. So they will go where they're going to make the most money. So where they're not going to make the most, they're not going to get much money, they kind of don't, go there. And corporatization has also led to social determinants of health being overlooked, and therefore leading to worsening of health disparities in both access to healthcare and also in the health outcomes. For an example, the retail clinic will be focusing on convenience. How do we get you to get service on the same day? But if you cannot pay for the same day service, because if you pay for it, you have less money to pay your rent and therefore will become homeless. They're not really focused on that. They are more interested in those who can pay for the same day service and pay their rent than those who are having housing challenges. So that is what I mean by there being so much focus on profitability, and social determinants of health are not quite overlooked. So it also has an impact in patient autonomy, whereby there's increasing decisions being made by insurance companies rather than providers, whereby healthcare providers and clinicians are providing services that insurance companies agree to pay for. For example, you may tell your patient this is the best procedure for you to take, but when the insurance company is contacted, and what we have a prior authorization, the insurance company would say we're not going to pay for this. This is not covered, but the doctor has a patient in front of them who needs to get well, and they're having to take provide services that insurance agrees to cover rather than what it is that the patient really needs. So that has taken away provider autonomy in terms of clinical decision making because of corporatization and how it's impacting them. And also, you have physicians being increasingly burnt out because of the focus is more on financial metrics rather than patient-centered care, whereby you have clinicians having less and less time allocated to see patients, with the focus being get them in and get them out as quickly as possible. So, which is leading to physician burnout, and physicians being also pressured to perform profitable procedures, and compromising what's it called for and focusing on that. So that's where we'll end with the second learning objective. Just hold on a bit and then come back and watch the third and final lecture video on this module.